Hello, my name is Dr. Shahrukh Hashmi. I'm a consultant here at the Mayo Clinic Transplant Center and also the director of the long-term follow-up clinic here within the blood and marrow transplant division. Graft versus host disease is a rare disease. It happens as a complication of bone marrow transplantation, which is equivalent to stem cell transplantation. What happens is that the immune cells of the donor, they recognize your body as a foreign tissue, a foreign organ, and they reject your body. What causes this? What are the risk factors? It's very complicated. Briefly, few risk factors we recognize include a gender mismatch. For example, if the donor is a female and the patient is male, that can cause an increased risk of graft versus host disease. And then certain genetic matches which are important for transplant, if they're not perfect, they can cause graft versus host disease as well. There are different types of graft versus host disease with different presentations. There's the acute graft versus host disease, which happens within few months of transplant. There's a chronic graft versus host disease that happens after a few months of transplant. It can happen after 1 year or even 2 years of transplant. And then there is a new category called overlap type of graft versus host disease, which has features of both acute and chronic graft versus host disease. The acute graft versus host disease, which can happen within few days, few weeks, or within, for example, 3 to 4 months of transplant, usually presents with the involvement of the skin, the GI tract, or the liver. Now, the chronic graft versus host disease is a unique disease that happens as a late complication of transplant and resembles a disease known as lupus. It can affect any organ system. For example, it can affect the eyes. Patients can have very dry eyes, which can lead to blindness. It can affect the mouth, causing dry mouth, difficulty in swallowing. It can affect the GI tract, cause persistent nausea, vomiting, diarrhea. It can affect the liver. It can cause scarring in the liver. It can affect the skin, sometimes, which can cause shiny skin or plaques on the skin, sometimes the joints. Now, it's important to differentiate between different types of graft versus host disease since the treatments are slightly different. Both acute and chronic graft versus host disease are very hard to treat. Once they become severe, treatments don't work. We have been doing stem cell transplants for the past 50 years, and yet we don't have a single medication approved in the United States for the treatment of graft versus host disease. Corticosteroids, for example, prednisone, still remain the backbone of the treatment of graft versus host disease, both acute and chronic. With 450 transplants a year at the Mayo Clinic Rochester area alone, we are a big group of BMT physicians with at least 16 physicians dedicated to inpatient and outpatient management of transplant patients. Here at the Mayo Clinic, we have clinical studies for both acute and chronic graft versus host disease. We have a dedicated clinic which is responsible for the management, recognition of graft versus host disease and its complications. We generally see the patients within 3 to 6 months of a transplant. We hope that with this organized clinic, we're able to prevent the complications of stem cell transplantation. We're able to detect the graft versus host disease early in different organ systems and treat it promptly so that the patient's survival is better, and also, equally important, the quality of life improves.